Running a business means juggling a lot of moving parts. And when your communication tools can't keep up, things start to slip. Missed calls, slow replies, scattered conversations. They're not just frustrating, they're lost opportunities and revenue left on the table. That's where Quo comes in, spelled Q-U-O. Quo is the #1 rated business phone system on G2, trusted by over 90,000 businesses. One shared business number for calls and texts, so every conversation stays visible, organized, and accountable. It works from an app or computer. You can keep your existing number, add teammates, and sync your CRM, letting you scale without adding complexity. And with built-in AI, Quo logs calls, summarizes conversations, and flags next steps, even after hours. Stop missing customers. Stop leaving revenue on the table. Try Quo free and get 20% off your first 6 months at quo.com/tech. That's QUO.com/tech. Quo. No missed calls, no missed customers.
Wow, you're still drinking soda?
Yeah, it's Zevia Creamy Root Beer.
Isn't soda full of sugar and bad?
Nah, Zevia doesn't have sugar or fake like other sodas.
Okay, but does it taste like?
Here, try one.
Oh, this is delicious.
Told you, Zevia. It's soda made better. No Find Zevia Creamy Root Beer, Orange Creamsicle, and more flavors at your local grocery store.
Welcome back to the Oral Health Podcast. Karen and I are joined by someone who is an expert on the topic we're discussing today, which is water fluoridation. Barry Cockcroft has been key to getting fluoridated water around the UK, and I'm going to let you introduce yourself, Barry, if you would like to.
Hi, I'm Barry Cockcroft. I used to be a dentist. I'm no longer on the register. Spent 25 years in general practice in a fluoridated area in Warwickshire, and then moved on to become Chief Dental Officer of England. I joined the British Fluoridation Society while I was Chief Dental Officer, and I've been a keen advocate for the use of water fluoridation as a preventive measure for as long as I can remember. And it's a subject that I'm unbelievably passionate about.
Yeah. So can you talk us through what kind of led to fluoride being added to the water supply in different areas of the UK? Because it's been a long road, hasn't it?
It's been a very, very long road. And I think the other thing is not to say fluoride being added to the water. What we do is adjust the level of fluoride in the water, because all water that comes out of a tap in this country has some level of fluoride in it. The fluoride ion is the 13th most common ion in the Earth's crust. But really, it was a combination of chance and inspired people, really. Certainly in the UK, the first thing that led to fluoridation happening came about as a result of the war. In about 1940, children were being evacuated from areas, and children from Tyneside, which was seen as a potential target for bombing, were relocated. Large numbers of children were relocated to the Lake District. And a community dentist in Westmoreland noticed that some of the children who came from Tyneside had the sort of dentition that you'd expect in those days. We forget these days that 70 or 80% of children had caries, DMF 4, 5, 6, very high levels of caries. But he also noted that a proportion of the children who came from Tyneside had very little decay or no decay and beautiful teeth. And he thought, what on earth is causing this difference? And this was a real challenge, because this was a day pre-internet, pre-data, pre-child dental health survey. So he actually went to Newcastle, or to Tyneside, where these children, and found out where the children, because it was pre-postcode as well. So he had to find out where the children with the good teeth came from and where the children with what he'd expected to see came from. And what he eventually found out was that the children with the good teeth came from south of the Tyne, where the water, and he then thought, what's causing this? And did a bit of exploration and found out that the water south of the Tyne contained levels of fluoride naturally that are effective in reducing tooth decay. So it came from that. And as a result of that, one of the first areas to be fluoridated was North Tyneside, because they wanted the children in North Tyne to have as good oral health as those in South Tyne. Ironically, later on, when a pipe system was introduced and the people in south of the Tyne were not drinking local water out of boreholes, that it was piped in, their oral health started to deteriorate. So ultimately, the children in North Tyne with the artificially fluoridated water had better teeth than those in the south of Tyne who were getting piped non-fluoridated water. This all came out. We recently had a very successful consultation in the northeast with another 1.6 million people going to receive fluoridated water over the next few years. And it actually showed that difference between the north and the south. And the great thing about doing it in the northeast is you hear all these scare stories, which I'm sure we'll come on to. People were not worried in other areas of the northeast because the people north of the Tyne already had artificially fluoridated water, and the only difference was they had good oral health.
I have to say, because I'm from Tyneside, North Tyneside specifically, hearing the story about how it like came about makes me feel quite proud of where I'm from, and that we had that kind of unintended impact, but it's still quite cool to hear. And obviously coming full circle, now there's the new scheme that's up, like, to fluoridate lots more of the northeast. It's kind of come back on itself.
That's really, what's the word? It's really, really important. First of all, it's not a political issue. When the legislation went through, the last lot of legislation, it was completely supported by both sides of the House. It's not a political issue anymore, which is a really, really good thing. And obviously, there's a greater focus on prevention now, which is also very good. The interesting thing is, though, things change a lot. And so we had this fantastic dental public health team at Birmingham: Peter James, Andy Anderson, and John Beale. And we were told that fluoride was included in the structure of the teeth in the fetus, so that's how it worked. But what we now know, it also has a massive topical effect, which for me as a septuagenarian, obviously, when I graduated, 70% of people of my age had no teeth at all, and that's completely changed now. So oral health of older people is really important now, and fluoride has a benefit for older people as well as for children. The thing about the children, though, that benefit, lasts a lifetime, and any restoration in a tooth, especially in the permanent dentition, it's going to need replacing, it's going to need treating, and it's probably going to get slightly larger each time it's replaced. So, the benefit for children is absolutely massive. I think people forget, when I graduated in, whenever it was, 1973, 70% of kids had caries. The DMF was 4. Now it's, well under 30% of children have caries, and the DMF is less than 1. So it's a massive, massive improvement. But that does not mean that we shouldn't strive to do even more to make, and it's so related to deprivation. If you read, we have to do legally, areas that are fluoridated have to do a report every 3 years on what's going on, and they just published one in March 26. It's available on Google. If you look at Fluoridation Health Monitoring Report 2026, you can see this monitoring report, and actually there's a very helpful short summary which is readable in about 10 minutes, which is very good. But just because things have improved a lot does not mean that we should stop and say, oh, that's great. And it's so related to deprivation. It's like Lennon, the late chair of the British Fluoridation Society, used to say that fluoridation gives poor children rich kids' teeth. And I think it's, there is an element of truth in that. It's probably a little bit of an oversimplification, but it's certainly got the message across.
Absolutely. I wonder as well, because we obviously know that it's so beneficial, what kind of goes into choosing to adjust the levels in certain areas over others? Is it just a case of rolling it out slowly, or?
I think initially, in the 50s and 60s, when things started to happen, there was no national public health, focus on fluoridation. It was driven by local people. In Newcastle, it was driven, I think, by local people because it had been clearly explained to them by the data that they'd seen from the children who'd been evacuated. And in Birmingham, the responsibility sat with the council, and John Charlton, who was on the BFS for a long time, was also a local councillor and a dentist, and he drove it. You know, if it wasn't for John, I'm pretty sure that the Midlands would not be as well fluoridated as it is now. I think the interesting thing, you mentioned the Northeast, and you're based in the Northeast and you're proud of that, and that's great. But people think, oh, we've got a new scheme and it's 1.6 million people, which is happening now in the Northeast. That's an increase of about 16%, because only about 10 million people get fluoridated water. So the 1.6 million people is a very significant increase. I think we're now much more data rich than we used to be. And I think I would expect people in the Department of Health to be looking at data, looking at the areas where caries is still a mega problem, obviously related to deprivation, and saying we need to target those areas. So, and I think that's happening. I think I went to the Association of Dental Groups reception in the House of Commons, I think it was in March, and Stephen Kinnock, the MP with responsibility for dentistry, cited water fluoridation as a major achievement of this government. So I'm very hopeful that more schemes will follow on from what the successful outcome of the Northeast.
Mm-hmm. I wonder as well, because we were talking a little bit before we sat down to record, the controversy or like resistance against fluoridated water, and I was shocked to read that because as part of the Smile Month anniversary, I've been doing research into like past decades and things, and anti-fluoride movements were really strong in like the 90s, from what I'd seen in like archives, which really surprised me. I think I naively sort of thought, oh, it's just the American influence that's getting to people now, but actually no, it's a long-standing issue of people resisting it.
Yeah, when I worked at the Department of Health, we used to say that good news writes white, you know, and that good news is not news. So if people are opposing something, they tend to get more publicity. You know, if you look at public health measures that have introduced over the years, I remember when I first worked in hospital after I graduated, it was pre-seat belts, and we used to see a middle third fracture almost every week, you know, from a car crash where somebody had impacted with the steering wheel. Yet when the legislation was introduced, to introduce mandatory seat belts, it was opposed by people, you know, because people say, oh, it's reducing, you know, my personal freedom, you know. And I think, well, you know, if it's reducing the burden on the NHS, then your personal freedom is a small price to pay for that. And people said, oh, people will get trapped in cars and burned to death. And the idea of getting into a car now and driving off without putting a seatbelt on, nobody in their right mind would actually do that. And, you know, introducing folic acid into bread and iodine into salt, and people have opposed all these things. So people, you know, and they use bad science, and I think bad science is very dangerous. You know, what the thing that's really important, and people say it causes harm, the thing that causes harm isn't actually the substance itself, it's actually the amount of the substance. And I think, you know, the amount of fluoride that's added to water in a fluoridation scheme, it's the equivalent of 1 inch in 25 miles. So that's an unbelievably small concentration. Anything in excess can be dangerous. If you drink 6 litres of water in one go, it can so disrupt your electrolyte balance as to make you ill, possibly fatally. Nobody would say that water was dangerous. And, you know, my daughter works in a neonatal intensive care unit, and when the incubators were first introduced, they gave oxygen under pressure to newborn babies, and it caused blindness. And nobody would say that oxygen is dangerous. It's the amount. So 1 inch in 25 miles is a minuscule amount. It's quite hard to visualize what 1 part per million means, but 1 inch in 25 miles gives you an idea of the scale. It's very, very small. And normally there have been lots of, you know, since I've been involved, just about every malady known to man has been blamed on water fluoridation. You know, bone cancer, IQ has been the recent one in America. But there's no robust evidence that shows that fluoride at the level at which we use in schemes causes any harm whatsoever. Like I say, the health monitoring report supports that. If you go to India or China, you'll find areas where the local water contains 20 or 30 or 40 parts per million naturally. And certainly in America, they produced a national toxicology program report, but it said actually in the introduction, this report must not be used in reference to water fluoridation because it's a higher level than is used in water fluoridation schemes. But that did not stop people who were opposed citing it as a reason. But the robust evidence that it's both effective, safe, and these days, really, really important, very cost effective, is overwhelming. I mean, if you look at the return on investment, I hate to use return on investment in a discussion on fluoridation, but in these days when money is tight, you have to do this. But it is the most cost effective way of reducing dental caries. The return on investment is massive. The capital cost, obviously, there needs to be an investment initially, but once you've made that capital investment, the revenue cost is minuscule. I think it's about 50p per person per year, which if you think of the benefit, and you know,
it saves the NHS money at the the root cause, doesn't it? Really, we used to have. I had when we used to run the dental helpline that I worked on. I had a guy phone up and asked if I allowed my children to have fluoride. I mean, born and brought up in Warwickshire, we've had fluoride all our lives, and he said, well, your children must be very stupid then. And I said, well, no, they're not, and they have perfect teeth as well, so you know, a bonus.
I can't imagine ever saying that to someone. Like, that's
because one of the things I learned as chief dental officer was sometimes people would be offensive. Sometimes they'd be deliberately offensive, but sometimes they'd be accidentally offensive. And the way to react is not to be offensive back or to be cross, it's just to reason with people, which I always try to do. But the other thing, of course, is that there are areas of the country where the fluoride is at the level that prevents tooth decay naturally, you know, areas of Hartlepool, some areas in the East Midlands, some areas in Essex, you know, and there's no evidence that that's caused any diminution of intelligence. And the IQ thing has been addressed in the latest monitoring report from the UK government, and it just dismisses it. There is no evidence to support that at all, and it's very hard to prove a negative. You know, if I said to you, chocolate biscuits reduce your IQ by X, you couldn't find a piece of research that said no, it doesn't. But on the balance of probability, you know, it's unlikely. But proving a negative is very difficult. And what happens is you just have to wait for the latest thing that, you know, that comes up in the media and respond to that. And that's what the health monitoring report has tried to do. You know, what are the latest things? And, you know, if people are interested, it really is a brilliant report.
Well, we'll add a link to it.
Absolutely, I want to read
we'll
it.
add a link to the podcast.
If you put on your website, that would be fantastic.
Yeah, we will do.
Yeah, of course.
Like I say, we meet regularly now with people from America, Australia, New Zealand, and the response to the health monitoring report from America has been great. They've circulated it in America. They think it's wonderful. So I think it's really, really good, and people ought to be proud of it. But I think the thing at the moment is, you talked about what areas are next. I think we are a very data-rich country now, and you know, if I was working in the Department of Health, I'd be saying, because it takes a time to do, and there is a capital investment to actually set up the plant initially, I'd just be saying what areas really need this, you know, and you've got great data which shows you where, you know, where oral health is poorest, obviously related to deprivation significantly. So, you know, you in the water system, at the moment you legally have to consult, and you have to consult in the area where the water goes, and that can be quite difficult to identify these days because, you know, the water system is so diverse. I remember when we wanted to fluoridate the water in Southampton, and some of the water would go into Hampshire, and Hampshire was a hotbed of anti-fluoridation, and ultimately we won the consultation, and they sought judicial review, and the judicial review supported the consultation. But then the Lansley reform changed the, how can I put it, the ownership of water fluoridation from the NHS to local authorities. That meant that the scheme in Southampton didn't go ahead, which was unbelievably disappointing. But we did learn a lot. And the great thing about the consultation in the North East is it was done, it was a virtual consultation done on electronically, where the consultation in Southampton and the subsequent judicial review cost getting on for £1 million. And it would have been impossible to spend that amount of money pro rata across the country. It just would have been very difficult. But everybody makes mistakes. I think, I've made mistakes in my life. Everybody's made mistakes, but you learn from a mistake. And I think the Department of Health learned from that. So the consultation was a web-based consultation in the North East, and that was brilliant.
I worry a little bit because I work with teenagers that are so influenced by like views on platforms and someone that just says something with confidence. Well, it must be true, and it's just not that way. But yeah,
I think you've got to accept that society is changing. The BFS, I mean, a couple of years ago we had an essay competition, and the guy who won the essay competition has just spent some time in America. It's been brilliant. But what we've realized is that the way people communicate these days is different. So we're about to launch another scheme, which is with young oral health professionals to come up with short, sort of, what I hate to say sound bites, but little short pieces that can go on TikTok. It's about how you get your message across. And young people, they are very astute these days. Some people, there will always be some people, there will always be conspiracy theorists. If you look back to COVID, I remember an interview with a guy on the street, actually, I think it was in Walsall in the West Midlands, saying he wasn't going to be vaccinated against COVID because it was just a government conspiracy to control everybody's mind. I always used to say to people, you can't please all the people all the time, but if you can please or convince most of the people most of the time, then you have to settle for that. I think there'll be some people who'll always be opposed to everything, really. Some people have a conspiracy view around government. It's quite challenging sometimes. But I think what we have to do is recognise that how people get their information now is different to how people used to get their information 30, 40, even 10 years ago. And we have to change how we provide information to people. And we at the BFS, like I say, we're trying to do that this year with this competition around little short bites. But the most important thing is to have robust data to back up everything you say. And fluoridation is the most researched public health measure there's been for years. I remember when I was at the Department of Health, a very, very senior person at the Department of Health said that if water fluoridation had reduced the incidence of any, or the prevalence of any other disease, the whole country would have been fluoridated years and years and years ago. Somehow people treat dental disease as slightly less serious, but the impact it has on people. Interestingly, when we did the consultation in Southampton, some of the most powerful advocates for water fluoridation were the teaching community, because they knew how much time children spent away from school having dental treatment, which ultimately is almost completely preventable.
Absolutely. And I would hope that now we know more about how dental disease impacts other areas of the body, that attitude might be slightly changing. I mean, I'm not in the high up space in these conversations, but I would hope that it's going that way.
Yeah, I think that's right. I think there are links between medical conditions and different medical conditions and oral health. Some of them are causative and some of them are just associative. Obviously, people who are obese are more likely to have a poor diet and therefore they're more likely to have dental decay. But I remember one thing that's come about recently, something when I was CDO, I saw a piece of research that showed that if you looked after the oral health of people in intensive care, they got less chest infections than people, because if you've got a mouth infection, if you've got gum disease in the mouth, you ended up with chest infections as a result of infection spreading. And obviously there are also other links, obviously diabetes is the obvious one, and some rheumatoid arthritis and things like that. But I think it's not, dental disease is preventable. And I think a good life, you could actually prevent a whole load of disease if you stop people smoking, if everybody had a good diet, but the world is not a perfect place like that. You've got to live in the world.
I think sometimes as well, people want a short fix, don't they? They want it to be, have a glass of fluoridated water and all their dental dreams are made. And it's more of a long-term thing. And I think that we live in a society where we want results and we want them right now. And maybe that is part of, we have to kind of wait and it's a continual thing rather than an instant.
Yeah, I think that's right. And there are two things. First of all, one of the advantages of water fluoridation is when you introduce a scheme, you see the benefits very quickly. Really comes through very quickly. And the other thing, you don't need to do anything. The great thing about water fluoridation is you don't have to change your lifestyle. During COVID, it was the only preventive measure nationally that carried on working during COVID. Because it doesn't, and the people who are less likely to change their behavior are also the people who are more likely to get dental disease. So fluoride in the water benefits people, who don't have to make those choices. The choice is sort of made for them. I think if there was a downside, I wouldn't be advocating as much. I mean, I live in a fluoridated area. I brought my children up in a fluoridated area. My grandchildren are brought up in a fluoridated area. If I had any doubt or any thought that this was damaging their general health, I wouldn't be as supportive as I am.
I think that's what it comes down to, isn't it? It's people that know what they're talking about back it. And also that if evidence came out that it was not as effective as was first thought, we'd change it. Like it's not, the scientific community is always adapting.
Yeah. I've been involved in it for years and years and years, not at the level I am now in terms of chair of the British Fluoridation Society, but when people were opposed to it, we used to do GA sessions in our practice. We did 2 GA sessions, a Tuesday afternoon and a Friday afternoon. And I loved my job. I enjoyed being a dentist. It was really great. But the 2 days I really hated were Tuesday afternoon and Friday afternoons. And I used to say to them, look, I said, if you really think dental disease is not damaging or terrible, come and just watch a GA session. It's depressing. It's horrible. It's brutal. It's unpleasant. And this is preventable. It's completely preventable, and it's just for me it's a no-brainer. But I used to, when we were at the department, people used to say sometimes doing the no-brainer isn't quite as easy as you think it might be. It takes a lot of work, and certainly several people have had a go at changing the legislation. The legislation was changed in '85 to make to enable more fluoridation to go ahead. But the legislation, it said, if there's a consultation, then and it's positive, the water company must fluoridate, and the word must was taken out and replaced by may. It's anecdotally, I was told that this was done by number 10 at the time because they were trying to privatise the water companies at the same time, and they didn't want to place extra, responsibilities on the water company. So when not long after I'd started the Department of Health, we went through legislation to change the word may fluoridate to shall fluoridate, and that was fundamental. And it was really, and the water companies were delighted because it meant they didn't have to make any decision. Once the consultation had happened, they had to do it, and they were not involved in any decision-making process at all.
Yeah.
I remember being in the House of Lords the first time I went into the Parliament as Deputy CDO, and it was debated in the Commons and in the Lords and then back to the Commons, and the peer stood up in the Lords and said he was opposed to it because he came from Worcestershire, and he was assured by local farmers that it was impossible to grow tomatoes hydroponically in fluoridated water, which was completely bonkers, and
we'd have no tomatoes in Warwickshire.
Yeah, what a strange.
It was a really, really weird thing. I remember it particularly well because I'd spoken to Paul Langmaid. I can't use the word Paul used because this is obviously going on a public. Paul said that the Lords is very polite. He said, but occasionally a peer will say something that is completely stupid. And when this peer said this, I turned to Paul and I said, that's your something stupid, although something stupid wasn't actually the term I used. But just said this, for some reason it had gone very quiet. And when I said something stupid or its equivalent, people heard it, and one of the stewards at the House of Lords came down to me and put a hand on my shoulder and said, "Sir, if you say something like that again in the House, I shall have to ask you to leave." So I said to my wife that night, I said, I said, this is the first time I've been in the Houses of Parliament, and I nearly got ejected on my first day. It would have been excruciatingly embarrassing. But we all had you have to smile about these things, and I smiled about it then.
Yeah. I wonder if, because we're approaching sort of time, if you have anything that you would want to share. Say if I mean, you've sort of covered this already, but say if I am a person that is against fluoride in the water, I don't want it, it's going to harm my children. What is kind of the one thing you would say to convince someone to think otherwise?
Why are you opposed to it? What is the reason? And then I would explain to them, especially the 1 inch in 25 miles, I think is quite a powerful message, and say that it's been done for, first scheme started 60, 70 years ago, and there's no evidence of harm whatsoever, and the evidence of benefit is overwhelming. I think the other thing to get across is what we learned in the Northeast was that it's really important to get local clinicians or, health fraternity, not just dentists, DCPs, dental, the dental community, but the rest of the health community, health visitors, people like that, to get them to understand that this is a public health issue which affects absolutely everybody. So, and to be able to stand up and, when you get somebody who makes one of these silly comments, I'm told that water fluoridation causes dementia, to give for these people to have the confidence to stand up and say that's not actually correct. There's no evidence. What we've got on the BFS on the website is answers to all these myths, so that people, if we do have another consultation, I'm hopeful that we will have some more consultations, that people feel strong enough and committed enough to be able to come out in public and say, you come from the Northeast, and the Northeast is they're very confident people. They're very proud of their Northeastness. And the last thing, we supported the local people, the local authorities to answer questions and stuff, but it had to be locally owned. I mean, the last thing people in the Northeast wanted was somebody coming from London and telling them what they should be doing. That would not go down well at all. But I think you need to have the local people, engaged and getting involved, and that's really important.
I totally agree. I think it's as well, if you can have the conversation in the pub, not that the pub's the third place for most people, but like it needs to be a bit more human than data on a sheet, especially for someone that's like not willing to engage with numbers for whatever reason. But yeah.
I learned to CDO that data is our most important tool, in managing health at a policy level. It took me about, like I say, we had a fantastic dental public health team at Birmingham, but it took me about 25 years to realize how good it was, when I became, and data is your most powerful tool, but you do have to, like you say, be able to put it across in a way that people who are not used to understanding data can actually understand. Like I say, I hate to mention it again, the 1 inch in 25 miles is such a good explanation of how little, what a small proportion is and what it is. If, don't know if I said it before, but if 1 inch in if it was that dangerous, then Mr. Putin would be spreading it on door handles. It's a bit of a challenge.
Yeah, it's such a good statistic. It really is. And you're talking about making sound bites for different social media platforms, and that's something that I think will get across how small that is. 1 inch is nothing.
Yeah, clinicians and academics who understand it and understand data. I remember there used to be a website, 1 in a Million, which is great because it then goes on to explain all the benefits. But the 1 in a million is a bit of a sort of ethereal comment. I mean, it's hard to sort of think in your mind what 1 in a million is, 1 part per million is. Like I say, that's why I love the 1 inch in 25 miles quote, because it just realizes how small it is.
Yeah. Before we finish up, I want to thank you for your time.
Right.
It's been a very interesting conversation, genuinely. I feel like I've learned a lot, and I know other people are going to find it very useful. And of course, we'll link to everything in the British Fluoridation Society and the report that you mentioned as well.
That's really great. I think the important thing is, because it's being in the too difficult box for so long, and now it's in the new box. There is a number of people in the middle, especially younger, on the BFS Next. We've now got younger people on the BFS exec, and we have to get the younger, because I always say to people, the young people in the profession are the future of the profession. Those are the people we need to get engaged more now, and that's what we're very keen to do.
Marketers, you know that feeling when your creative clicks? When that social post sends engagement through the roof? When your outside-of-the-box campaign hits ROI positive? When a personalized homepage turns prospects into customers? It's utter marketing bliss. Contentful helps you create tailored omni-channel experiences without working overtime. No stress, no limits, only possibilities. Get the feels at Contentful.com.
Business is booming, but you know what really helped? Xero, the accounting platform for small businesses. I used to think unpaid bills were just part of it. Ugh. But batch payments? Wow. Automated accounts payable? Even better. All in one place. That's a big one. And I can keep track from my phone while I get the job done. No bills in sight. What a life. Do right by yourself and your business and search Xero for your free trial. Conditions apply.
While every other channel is fighting for your customers' attention, podcasts are where they've already given it. No one accidentally listens to a podcast for 45 minutes. They choose to be here. They trust the voice in their ears, and when that voice talks about your brand, it doesn't sound like advertising. It sounds like a recommendation from a friend. Acast gives you that trust at scale. Digital precision, host-read authenticity, and performance data that proves it worked. Don't fight for attention. Buy it with Acast. Learn more by visiting acast.com/advertise.